Welcome friends to this presentation on urea estimation. How is urea a renal function test? Although urea is produced as an end product of amino acid metabolism and is produced mainly in the liver as a part of the urea cycle, urea is excreted only through the kidneys in the body. So any disease of kidney affect the rate at which urea can be excreted. If the urea excretion has decreased, the levels in the blood will increase. So a raised urea level in the blood indicates that its excretion is defective, which indicates that the kidney is not functioning properly. The method that we use to estimate urea is the Acetly Monoxime method. The principle of this test is that urea reacts with Acetly Monoxime to form a pink colored compound. The concentration of urea in the solution is proportional to the concentration of the color developed, which is read in a colorimeter and compared to a standard treated similarly. Along with creatinine, urea forms a very good renal function test. The normal levels of urea in the blood is between 15 to 45 milligrams per deciliter. There is a concept nowadays which we talk about the blood urea nitrogen. Now if you look at the molecule urea and go with the molecular weights, nitrogen, there are two molecular weight 14, so 28, carbon 12, 28 plus 12 is 40, oxygen 16, so that is 56, plus 4 of hydrogen, that gives us 60. The molecular weight of urea is 60, of which it has got 28 of nitrogen. So if you take the nitrogen in urea, it is 60 divided by 28, which is 2.14. So if you want to convert urea to Bun, we divide the value of urea divided by 2.14. It is just a mathematical explanation, because while we talk in terms of urea levels, the people in the US talk in terms of Bun. It is the same figure but a ratio. The other methods for estimating urea include using the urease method, which includes the Berthelot's method and the Nestler's method. There is also another method which uses glutamate dehydrogenase. So the methods for estimating urea include the Acetly Monoxime method, the glutamate dehydrogenase method, the Berthelot's method, the Nestler's method. In a fully automatic analyzers, we generally prefer the glutamate dehydrogenase method. In semi-auto analyzers, we prefer the Berthelot's method. The Berthelot's method is probably the most sensitive method for estimating urea. Conditions in which the ureas increase. Think of a kidney disease and blame the increase of urea because of that. Shock and dehydration. This is called pre-renal causes of raised urea. Renal disorders like glomerulonephritis, pyelonephritis, acute kidney disease, chronic kidney disease, and post-renal, that is as an obstruction because of stones, cancer present upon the ureter and strictures. Now why is urea increased in cases of shock? After the blood is filtered in the glomerulus, it runs along the loop of Henle's before it reaches the distal convoluted tubules. In the loop of Henle, because of the countercurrent mechanism, a part of urea gets absorbed. As long as the blood volume is good, the blood pressure is good, the amount of time that the urine spends in the loop of Henle is less, the amount of urea which is being reabsorbed is negligible, so there is no problem. But in cases of shock or hypotension, where the pressure is low, the flow of urine in the loop of Henle is slow, the urine stays for a longer time in the medulla, and a significant amount of the urea gets reabsorbed. That is why in cases of shock, the urea levels are high. Creatinine, unlike urea, does not get reabsorbed. So in shock, you will find that the urea levels are very high, whereas the creatinine levels are normal. This tells us the ratio of urea to creatinine. If it is very high, it indicates that there is a pre-renal cause for the raise in urea. Low urea, very rare, only seen in liver disease, that too severe liver disease, where most of the hepatocytes have been wiped out and the urea cycle does not occur. In such a condition, we will find that the serum ammonia levels are increased. So the only cause of low urea is a severe liver failure, and this will be associated with increase in the ammonia. Some of the causes stated in the books include anabolic states and pregnancy, where the urea levels will be lower than normal, not very low. Thank you.